If this scene sounds familiar, you're not alone. Millions of Americans over 60 wake up 2, 3, even 6 times a night to empty their bladder. Doctors call the pattern nocturia, but to us it feels like stolen sleep, foggy mornings, and a constant undercurrent of worry. Will I trip in the dark? Will my heart handle yet another broken stretch of rest? Tonight we're going to walk through that hallway together, but instead of frustration, we'll carry a flashlight of knowledge. By the end of our journey, you'll understand why your bladder calls the shots after midnight, what's truly at stake, and most importantly, how to reclaim the deep, uninterrupted rest your body deserves. Let's start with an honest inventory of the invisible price tag attached to every nighttime trip. Shallow sleep, tired days. Fragmented rest robs your brain of the deep wave cycles that file memories and reset mood. Chronic drowsiness raises the risk of depression and slows reaction time. Falls and fractures. A single misstep on the way to the toilet can change a life forever. Hip fractures double the chance of nursing home placement. Heart and metabolic stress. Repeated awakenings spike blood pressure and stress hormones, nudging glucose and cholesterol in the wrong direction. Medication dominoes. Sleeping pills taken to push through can backfire, causing grogginess, confusion, and even more falls. In other words, those nocturnal bathroom breaks aren't just an annoyance, they carry real health consequences. That's the tension driving our story forward. Every minute of lost sleep chips away at strength, independence, and peace of mind. To solve a mystery, you first map the scene. During the day, kidneys filter blood at full steam, and the bladder dutifully signals when it's about half full, usually every 3 or 4 hours. At night, a well-tuned body does 2 clever things. It produces less urine. The brain releases antidiuretic hormone, ADH, to slow kidney output. It raises the bladder full threshold. Stretch receptors get lazier, letting you coast until morning. When that elegant rhythm falters, because hormones dip, bladder muscles twitch, or fluid simply keeps pouring in, midnight marching begins. Understanding which gear slipped out of place is the key to fixing it. For men, an enlarged prostate can pinch the urethra like a twist tie, limiting flow in the day and causing incomplete emptying at night. For women, postmenopausal estrogen loss thins the bladder lining and pelvic floor support. Both sexes face these additional suspects: overactive bladder, OAB. The detrusor muscle spasms without warning, shouting, "Go now!" even when only a sip of urine is inside. Nocturnal polyuria. Kidneys ignore the nighttime slowdown and keep the faucet wide open, often linked to sleep apnea, heart failure, or high-salt diets. Newsmedical.net medications, diuretics, certain blood pressure pills, lithium, and even evening pain relievers can goose urine production. Hormone shifts. Lower ADH levels with age, plus fluctuating cortisol and melatonin, scramble the pee-sleep handshake. We'll tackle each one, but first, let's tighten the suspense. Picture Martha, 78, retired librarian. Her cardiologist recently upped her diuretic dose to tame swelling in her ankles. By sunset, her legs look thinner, but come 1 a.m., she's up. By 2 a.m. again. By 3 a.m. once more, shuffling past photo frames of her grandkids while gripping the hallway rail. Tonight, Martha's fatigue is so deep that on her 3rd trip, she forgets to turn on the nightlight. Her slipper catches the rug, and she jolts forward. A near miss. Heart pounding, she makes it to the toilet, but trembles at the realization, next time I might not be so lucky. That visceral uncertainty, will there be a fall, a fracture, a 911 call, is the stake that holds our attention. And just like Martha, we crave resolution. Before any pill or gadget, clarity comes from detective work. Start with a 48-hour bladder diary. In 2 neat columns, record every drink, with ounces, and every void, with time and estimated volume. Add a star beside each nocturnal trip. Patterns jump off the page. Giant mugs of tea after 8 p.m., a 1 a.m. surge that doubles all other voids, a final wake-up within 30 minutes of taking your morning medications. Bring that diary to your clinician. Expect urinalysis to rule out infection or sugar spill from diabetes, blood tests for sodium, glucose, and kidney function, post-void residual scan to see if the bladder empties fully, sleep study if snoring or gasping hints at apnea, medication review, often the low-hanging fruit. Armed with data, you and your provider can pick the right lever to pull. The American Urological Association urges clinicians to start with behavior because, surprise, it often beats pills and carries zero side effects. Awanet.org, fluid curfew. Front-load hydration before 6 p.m. Sip, don't gulp, after dinner. Total daily target, around 64 ounces unless otherwise directed. Salt whisper. Sodium drags water out of tissues and into the bloodstream, upping overnight urine. Aim for under 1,500 milligrams per day. Caffeine and alcohol audit. Both inhibit ADH. Nix them after lunch. Leg elevation or compression. Prop calves on a cushion for 2 hours before bed or wear compression socks. This drains ankle fluid back to circulation early, so kidneys handle it before lights out. Night light and clear path. Even if trips remain, you cut the fall risk in half with motion sensor LEDs. Each change is a stepping stone. Together they pave a safer, drier night. Think of the pelvic floor as a hammock of muscle fibers hugging bladder and bowel. Weak strands sag, strong strands spring upward, clamping the urethra when pressure rises. Kegel exercises, slow squeezes of those very muscles, can shrink nocturia episodes by up to 40% in adults over 70. MayoClinic.org. Try it with me. Sitting tall, inhale, then exhale and gently tighten the muscles you'd use to stop gas. Hold for 5 seconds, release for 5, aim for 10 reps, 3 sets a day. Within 6 weeks, you'll notice firmer control and fewer leaks on the dash to the bathroom. When lifestyle and muscle rehab aren't enough, pharmacology steps in. The 2024 guidelines highlight 3 main categories: Awanet.org, Healthline.com. Beta-3, agonists, mirabegron or the newer Vibegron calm bladder spasms without the memory fog linked to older anticholinergics. Desmopressin nasal spray, a microdose of synthetic ADH that tamps down kidney output for 6 to 8 hours. Recent reformulations cut the risk of low sodium, hyponatremia, but labs must be checked within a week of starting, especially in adults over 65. Newlangoni.org, alpha blockers and 5-alpha reductase inhibitors. For men with prostatic obstruction, drugs like tamsulosin or finasteride can widen the channel. Every pill is a tool, none is a magic wand. Work with your provider for the smallest effective dose and schedule labs to monitor side effects. A minority of patients need bigger guns. Minimally invasive BPH therapies, steam ablation or Urolift implants widen the prostatic tunnel in under an hour. Tibial nerve stimulation. A hair-thin needle near the ankle sends gentle pulses that normalize bladder signaling over 12 weekly sessions. Sling or bulking for stress leaks. In women with mixed incontinence, supporting the urethra eliminates the drip and dribble that can trigger nighttime urgency. None of these are first steps, but knowing they exist keeps hope alive if simpler routes fail. Back to Martha. She logs fluids, learns her diuretic peaks 4 hours after swallowing. With her doctor, she moves the pill from 4 p.m. to noon. She props her legs on a stool during Jeopardy and trims her salted nut habit. 1 month later, her bladder diary shows 3 wake-ups reduced to 1. Encouraged, she starts Kegels during commercial breaks and adds mirabegron. By the 3rd month, she sleeps 5-hour stretches, something she hasn't done in a decade. Notice the forward motion. Tiny steps add up, stakes drop, confidence climbs. Then it happens. A Wednesday in early spring. Martha climbs into bed at 10 p.m., reads 2 chapters, clicks off the lamp, and nothing. No bladder alarm at midnight, no stumble at 2 a.m. She opens her eyes to morning sun filtering through curtains and a cardinal chirping outside. Clock reads 5:58 a.m. A full night. Tears well, not from pain, but from relief. This is our story's climax. Proof that change is possible, dignity restorable, nights reclaimable. On the surface, tonight's tale is about frequent bathroom trips. Beneath, it's about respecting the quiet signals your body sends. Ignoring them costs precious sleep. Honoring them yields vitality. The silent iceberg under every medical symptom is this truth. Your body is not yelling, it is whispering requests for care. Tend the whisper before it thunders. Before we land, let's lock in the essentials. Bladder Diary. 2 days, honest numbers. Fluid curfew, front load H2O, cut evening caffeine and alcohol, salt and socks, less than 1/500 milligram sodium, elevate legs or compress. Kegels, 15 squeezes, 3 times a day. Review RX, ask about timing or dose shifts for diuretics. Discuss meds, beta-3 agonists, desmopressin, or prostate therapy if needed. Safe sleep zone, night lights, clear path, non-slip slippers. Write this checklist on a sticky note by the fridge. Each checkmark is a brick in the bridge back to restful nights. So, dear listener, as twilight deepens and the hush of evening settles over your home, remember, frequent urination at night is common, but it is not an unbreakable curse. It's a solvable puzzle. You have the map, the diary, the lifestyle levers, the muscle drills, the safe medications, the advanced options. You carry the flashlight of knowledge, and each step you take is steadier than the last. Tonight, when you tuck in, breathe easy. If your bladder calls, you'll know why. And with each passing week, that call will grow softer, until one morning you, like Martha, wake to birdsong and see the numbers you've been longing for. 5:58 a.m. Sleep well, guard your energy, and remember, you command the hallway now, not the other way around.